right, good afternoon, everyone. Okay. Thank you all so much for being here today. I'm Senator Tamika Isaac Devine, and unfortunately we cannot have microphones in here, so I'm going to try and use my mommy voice, so hopefully everyone can hear me. As you can tell from the crowd here today, that Reproductive Health Advocacy Day is a very important day here at the State House, and this is a very important issue in the state of South Carolina. Very important that we restore, improve, and strengthen reproductive health care in our state. Yes, as we've seen so far this year, some of our colleagues are interested in doing just the opposite. This has been one of the most consequential legislative years in recent memory when it's been one attack over another, facing people that have already been overlooked, marginalized, ignored, and dismissed. Our bodies are not our own. Are we living in 2026 or we are in 1826? Because honestly, we can't tell anymore. Look around. Does this place look like a place that you would come to for health care? Does this place look like you would come to for advice about your own body? But with all the things going on in our state, our children needing to be fed, our education system needing to be addressed, our roads and infrastructure crumbling around us, this legislative session has focused on punishing women who get an abortion with the death penalty. They have focused on law enforcement tracking all medications that we take and what medications in our system might end up in the toilet. We have policing where we all go to the bathroom and checking birth certificates and demanding a visual inspection to make sure that you are in the right gender. It has been an endless attack on personal freedom and privacy from the folks who claim that they are about liberty. South Carolina has the third highest rate of arresting women based on their pregnancy outcomes. Let me say that again. There are 47 other states that come before us that do not criminalize pregnancy. A woman has a miscarriage at home, they want to lock her up. A woman uses cannabis to let her continue her pregnancy instead of anti-nausea or seizure medication, they want to lock her up. A pregnant woman was shot, but it was her fault for being in the wrong place at the wrong time. Another woman miscarried at home before she even knew she was pregnant and told the hospital she flushed the toilet and they wanted to lock her up. Never mind that there are no laws in South Carolina which stipulate when we're supposed to report a miscarriage or what's necessary to punish women for our own bodies. But y'all, time is enough. Our voices are strong, and we are stronger together. And every single day that we come up here and we make sure that our voices are heard, we will be heard. But we need more people up here. Me and Margie cannot do it alone. The ladies in the House cannot do it alone. And the strong men like Representative Bamberg, they help, but it's not enough. So we need to make sure our voices are heard, that we stand up, we speak up, and we shout when necessary. Yeah.
Good afternoon. Can everyone hear me? Okay, all right. I have a toddler, so you know. Good afternoon. My name is Dr. Ladrea Williams-Briggs. I'm a South Carolina native, a maternal health advocate, a wife, and a mother. I'm also the executive director and founder of #NotUsSC, a community-based organization dedicated to improving maternal health outcomes for Black women in our state. I'm here today to talk to you about education, autonomy, and justice. As a survivor of HELLP syndrome, a rare but life-threatening complication of pregnancy, I know what it feels like to have to advocate for your own body while navigating systems that are confusing, stressful, and too often dismissive. During my pregnancy, I checked all the boxes. I went to every appointment. I had good health insurance, a stable income, a strong support system. I lived in an area with plenty of healthcare options and was pursuing my doctorate degree in maternal health education, and I still almost died. That tells us that this is not about personal failure. Unfortunately, my story is not unique. We've all seen the headlines. The woman sent home too early, the mother whose pain was minimized, the family left asking how could this happen, the recent passing of my colleague, Dr. Janelle Green-Smith. Too often, we try to isolate these stories as singular incidents instead of recognizing the deeper issue, systems that fail Black women. Here are the facts. The United States ranks highest among developed nations for maternal deaths. South Carolina ranks 8th highest in this country for maternal mortality. Black women in our state are 4 times more likely to die from pregnancy-related causes than their white counterparts. And over 90% of these deaths are preventable with timely and appropriate care. This is not about biology. This is not about personal failure. This is about systems. This is about access. This is about whether people who experience pregnancy have the information, support, and respect they need to make informed decisions and receive quality, evidence-based care. Hospital closures in our state, gaps in maternity health care make it even harder. Many counties in South Carolina don't have a birthing center, an OBGYN, or even a hospital. We need education that is early, culturally responsive, and empowering. We need communities that are supported to recognize maternal health warning signs and speak up when there's a problem. We need systems that listen the first time, and respect for the doulas and midwives who expand access to care for so many. We need policies that protect bodily autonomy, create medical safeguards for Black women, and expand crucial services for those that are most vulnerable. For people that look like me, reproductive justice is not one issue. It's safe pregnancies. It's quality prenatal and postpartum care. It's being heard during labor and delivery. It's surviving childbirth and having the support to heal physically and mentally afterwards. Because no one should die giving life. Not me, not her, not us, not anymore. Thank you.
My name is Lacey Lane. I'm a mother and educator in South Carolina. I am here because abortion bans are not theoretical to me, they are deeply personal. In 2017, I was pregnant with a very wanted and planned pregnancy. At 18 and a half weeks, during my anatomy scan, my doctor found something wrong. We were referred to a maternal fetal medicine specialist for a more extensive ultrasound. That night, my then almost 3-year-old son bit into a cupcake, revealing blue icing that announced to him, my husband, and I that we were expecting a boy. We named him Evan, and we hoped for good news at the ultrasound appointment. The next day, we learned that Evan had a rare and severe neural tube defect called occipital encephalocele. His brain was growing out through a hole in the back of his skull, causing multiple brain anomalies. We were given 2 heartbreaking options. We could carry to term, not knowing when he would most likely die in utero or in palliative care soon after birth, or we could end the pregnancy. And we were told we should make our decision quickly due to the 20-week ban that was in place at the time. After meeting with additional medical specialists and much discussion with my husband, I made the decision to have a second trimester abortion. I chose to spare my baby the possibility of knowing only a short life outside my body filled with pain. I chose peace for my son, Evan. I chose what was best for my family. The decision was heartbreaking, but I know it was the right decision. And if that same pregnancy happened today under our extremely restrictive abortion laws, I would be forced to leave my state to receive care. At one of the worst moments of my life, I would have to travel away from my doctors, away from my support system. And we cannot pretend that traveling for health care is an option that's available for everyone. For too many South Carolinians, it is financially and logistically impossible. No person facing a medical crisis should have politicians standing between them and access to health care. In 2019, we welcomed our rainbow baby. I am grateful that I was able to make the medical decision that allowed my family to heal and move forward. There is no hierarchy of reasons for abortion. Every story is personal. Every circumstance is different, and these decisions belong to the people making them, not politicians. I'm asking our lawmakers to vote no on abortion bans, restore access to abortion health care, and protect the right of the people to make medical decisions in South Carolina for themselves. Thank you.
Hello, thank you for coming. Quite frankly, I think we should have thousands of women here today for the stakes that are for the things that are at stake for us in South Carolina. Hundreds and hundreds of people showed up here in October to battle a bill that would send women, their doctors, their families and friends, anyone who helps them, to jail. If your daughter had been raped and learned that she was pregnant as a result, you could go to jail for 30 years just for taking her to Virginia for help. What would you have done? If I gave that mama a telephone number to an abortion clinic in North Carolina, I could go to jail for 30 years. I'm sure they would love that. That bill failed, but they never stop. They just won't stop. There are presently in South Carolina 30 bills pending right now that will restrict our reproductive rights. As they turn around and say, oh, but you have parental rights not to give your child a vaccine. It's crazy. I stand here representing the sister senators that South Carolina, the state of South Carolina, allowed 3 women in the South Carolina Senate to be kicked out because they dared to care for reproductive rights and dared to care for the majority of women in South Carolina. What are we going to do to change that trajectory next year and the year after and the year after? We've got to keep showing up, keep getting in their faces, and tell them to stop the hypocrisy. There are good bills right now to improve health care. There are bills that would help provide tax incentive so that we can care for our children. But do they care about those bills? There are bills that would improve the life for all our neighbors, but have any of those bills been considered? Why not? Why not? But because they're at the end, they don't really care about reproductive rights. They don't care about women. They care about control. I am sick and tired. Are any of you sick and tired of this foolishness? It's exhausting for women to have to come up here to beg legislators not to kill them. It's exhausting and shameful that Senator Devine and myself have to remind them to stay from under my dress. It's exhausting to hear a bill that they all voted unanimously for, that's an ombudsman bill, that they'd rather pay tax dollars for one person to tell a woman how to have a baby. I got news for you. We've been doing this from the beginning of time. I am sick of the hypocrisy. We have been in South Carolina at the 8th highest rate of women who died during pregnancy and birth. What are we doing? The 5th highest rate of babies who die before their first birthday. What are we doing? The 10th highest teen pregnancy rate. What are we doing? But yet, South Carolina has the distinct pleasure of this past weekend having 973 cases of measles. Applaud yourself from the right. South Carolina ranks the worst state for overall health, obesity, diabetes, and I've already talked about measles, uninsured residents, the fastest transition of doctors getting the hell out of this state. And we think that's a good track? No, it's not good. I am so sick and tired of us sitting here and playing nice. It's time to turn the page for us to get other women that are sitting home and not realizing how important this issue is. It's time for us to start kicking ass on this issue. These the bills that we have before the legislature right now, they're focused, and they're going to continue to focus on abortion. They're going to continue to focus on trans. They're going to continue to focus on bathrooms. Haven't they ever heard of unisex bathrooms? They're going to continue to focus on monitoring our medicines, not realizing that medicines have dual purposes. But yet, I have never been opposed even more than when I said, these children that I'm trying to protect with my measles bill are the ones you forced us to have. They don't get that. It is time for us women and sensible men, because we need our men to fight with us. It's time for us to grab some people, because I'm seeing the same people come up to the State House. It's time for us to grab some people and call out the hypocrisy and get some help, because we need to start focusing on feeding our children, educating our children, and keeping them alive, and when they go astray, not killing them by electrocution or by firing squad. We've got to do something to change the way South Carolina is. And it's up not to me and Tamika, not to Justin Bamberg, not to Jermaine Johnson. It's up to you, because this is your state. Thank you, and continue to fight with us.
My name is Jace Woodrum, and I am the Executive Director of the ACLU of South Carolina. I am also a transgender man. Although I was born female, I have lived for the past 12 years as the man I've always known myself to be. Thank you. I am here today because the General Assembly's relentless attacks on our rights are harming our health. I am here today because transgender people and women must stand together in the face of constant attempts to divide us. Yeah. And I am here because enough is enough. You know, our legislators are in session for 40 days. That is it. 40 days. Are they spending time on what is important? No. No. They haven't addressed the cost of groceries or the pothole that I'm pretty sure took off a tire on the way into work, right? They're not addressing the things that matter to us. Just this morning, a Senate subcommittee passed a bill to prohibit transgender people from using restrooms that align with who they are. It's a bill that already passed the House. So it requires trans people to use restrooms that match their birth certificates. Look, this bill hurts transgender people like me. My birth certificate says female, but no one wants me in the women's restroom like this bill would require. This bill also hurts women, because anyone that doesn't look like society's model of what a woman should be could be confronted in the restroom or even sued just for being there. South Carolinians should really ask ourselves, do we really want to establish bathroom police? Do we really want to encourage people to question others about their sex and their gender while they're in the restroom? Look, that's not the only legislative proposal that aims to hurt transgender people. I want to tell you about one more. Legislators also want to prohibit transgender people from updating their birth certificates and driver's licenses. So you have to use the restroom that aligns with your birth certificate, but you can't update your birth certificate. So it's no coincidence that these bills are moving forward at the same time, and the message from too many people in this building is that we don't want transgender people in our communities. It isn't just transgender people who will be harmed, though. What happens when I'm pulled over for a traffic stop? When I'm carded for ordering a beer I most certainly need after a day like today? When I'm going through security at the airport? What happens when I hand over my ID that says female? It makes no sense. This is not common sense policymaking. South Carolinians do not want these extreme, out-of-touch proposals. Our legislators need to get their priorities in line and start spending their time and energy, their 40 days, on improving the lives of all South Carolinians. Thank you.
All right. Can y'all hear me? So I get the benefit of bringing us home today. And what I want to say is simple. You see, over here, the South Carolina House of Representatives, see, they think that they're the strongest body in the state. And over here, the South Carolina Senate, they think that they're the strongest body in the state. And I just want to tell you that the strongest bodies in the state are the bodies of all the ladies you see here, of all the ladies in the state of South Carolina. And I echo what my colleagues have said. Enough is enough. I came up to this place at 26 years old. I was a young man. Now I'm a little older. And over the last decade, year after year, it's been bill after bill, it's been attack after attack, and I'm fed up and I've had enough. I think you all are fed up and have had enough. But being fed up and having enough is no longer enough. Because every year, I come up here, Margie comes up here, Tamika comes up here, Jermaine comes up here, and we have these fights, and we get our teeth kicked in every year. And we get run over by big government South Carolina, by the big government Republican Party. And we get up off the ground, tire tracks and all, and we keep fighting your body and invade the privacy of your doctor's office. 2 bills filed to get rid of state income tax. One of them is mine. Send a message, y'all. We can say everything at this podium. We can gather. We can look pretty. Ladies, y'all look beautiful. Give yourself a round of applause. But that ain't enough, y'all. It's an election year. So just remember these 2 words. Get active. Thank y'all so much.